I think the benefits are multifold. Number one, for the patient, you're able to intervene on their behalf and help them feel better right away so they don't have to wait as long. And that's a godsend for many of our patients who present in the acute care setting. For the clinician in the ED, it's also very helpful because it helps to have a positive impact. The patient gets diagnosed or feels better faster, and hence they can either move to another floor for a therapy, or they can get an additional therapy down in the ED right away. They can get a more accurate therapy, or if they're taken care of, they can be discharged home, and that's great for everybody. So it has a favorable impact on the clinical workflow in the emergency department. Lastly, for the radiologist, the benefit is the radiologist is an active participant in helping to take care of the patient. They become actively involved in patient care. They become a face that gets attached to the patient. So they're not only just doing a procedure, they're going to see the patient later on afterwards and follow up after the procedure and help take care of that patient. So as far as the patient is concerned, that radiologist becomes their doctor. There are no shortcuts with respect to proper patient evaluation and preparation. This is not just a procedure. These are not just procedures. They require preparation. You have to, first of all, see and talk to the patient. You have to evaluate the patient. You have to get to know your patient. You have to know their prior history. You have to know why they're there. You have to know why the procedure is being requested. You have to know if it's indicated. You have to look at their prior imaging studies. And as radiologists, we're good at that. And we can localize those and see what we think about them. So we could put the imaging together with their clinical evaluation based on our examination and the history that we obtained from the patient. We put this all together to decide if they indeed are a candidate for the procedure that's being requested. We also want to make sure that there are no contraindications such as allergies or any kind of bleeding disorders or any kind of medications that might cause bleeding that need to be stopped on a timely basis. So we have to check into all of that so that we can perform a safe and efficient procedure. Lastly, we have to get informed consent from the patient. So we have to explain risk, we have to explain benefit, we have to discuss alternative treatments. This way, we get the patients to understand that we really understand the complexity of their situation and what needs to be done. And this gets better patient buy-in toward having the procedure. It builds patient confidence, and it really helps to condition the expectation on the part of the patient. So if we follow these steps, we end up doing procedures safely, efficiently, and on the right patients. Well, what I would like to leave folks thinking about is this. For decades, there's been this perception of the radiologist as someone in a dark room who's looking at diagnostic studies and not interacting with patients. I think this has completely changed over the past couple of decades. Radiologists are increasingly being involved in patient care. And the arena of spine interventions is an example of this, where we're actually a face in front of the patient. We're no longer invisible like the X-ray. We're seen by our patients, we're seen by clinicians. This garnishes respect from all parties and makes us have a favorable impact on the value-added healthcare proposition.